the patient in Australia or US or UK is different compared to patients in the developing countries. When I was a medical student back in India, there was no emphasis on communication skills, empathy, rapport, involving patient in the decision making. Usually the doctor tells everything and the patient has to follow. Unfortunately, if you are sitting an OSCE or a clinical exam in any English speaking country or developed country, you will fail if you do that. Here, you have to involve the patient in the care, which means first thing you need to do, as you can see on the screen, you need to understand your patient needs. How do you do that? Is by active listening. So this is one thing I learned is ask open-ended questions and let the patient talk. Your job is to just listen to what the patient is saying and then have clear communication, which means don't use jargon. Lot of doctors or medical students are under pressure and they use lots of jargon with the patient. Do you think you have deep vein thrombosis? Have you ever had pulmonary embolism? Do you have right upper quadrant pain? People use all these terminology and that is not clear communication. Then if the patient has pain or if the patient did not have sleep, there is no empathy. Or if the patient says, doctor, my friend passed away yesterday and I could not sleep for the last 3 days, or whatever, if they say something like that, there should be empathy. And you should involve the patient in the decision making. For example, if it's a teenager or a child, you say, okay, you need antibiotics. Would you like to have a suspension or a tablet or a cream for this skin wound? So usually you have to involve the patient, or you tell like Mr. Smith, you need investigation. X-ray will cost you this much, CT scan will cost you this much, this is the amount of radiation risk from a CT scan, and MRI has got no radiation but it will cost you a lot. What would you like? So you have to involve the patient in the care, in the decision making, and let the patient make the decision. And that is when you will be a successful doctor, or you will pass the clinical exam or OSCEs, because you're doing a patient-centered care, which means that patient is making the decisions. Your job is to help the patient make the decisions, not to make the decisions for the patient. So it is very, very important. The communication aspect is a big thing in any English-speaking country or developing world. So I would say emphasize on that, and that will give you lots of success and you will be a great doctor and a clinician. I wish you all the best. Make sure you subscribe to the channel and I will see you in the next few videos.